Hi, my name is Jonathan Van Nuys. I'm a nurse practitioner and I'm a study clinician at the Invite Home study at UCSF. And this is going to be your checklist step-by-step process of preparing for and giving the injection and post-injection. You can refer to it at any time. It will be here for you. And we will also be practicing in person. So here we go. First, you're going to gather your materials, verify the prescription. So make sure the box has what it's supposed to have, the rilpivirine and the cabotegravir, and confirm that the medications in the box match the dosage and frequency that you agreed on with your healthcare provider. We're going to gather our supplies and set the stage now. So grabbing the Cabenuva injection kit, gloves, alcohol wipes, sterile gauze, sterile pad, adhesive bandages, and a sharps disposal container. We're going to choose a nice, well-lit, clean area to assemble all of our supplies and get ready to prepare for the injection. So it's a good idea to inspect both vials now and check the expiration date. Very important to make sure it's not expired. If it is, don't use it. And look at the medication and make sure it's clear and free from particles or discoloration. If you notice something unusual, abnormal, do not use it. And make sure the medications are stored in their original containers. So now we wait. So after we take the medication out of the refrigerator, we need to wait at least 15 minutes to allow the medication to come to room temperature. This is a good time to wash your hands, put on gloves, we can chat. And now we're ready to prepare the injections. So you're going to take one of those vials and shake it vigorously for 10 seconds up and down as shown. And then turn that vial upside down and confirm that the medicine's uniform. If not, go ahead and give the vial some more shaking. It's normal to see some small air bubbles. And now we're ready to remove the cap. So remove the vial cap and then take your alcohol wipe and wipe the rubber stopper. Wipe it clean and don't allow anything to touch it after wiping it. The next step is to remove the backing off of the vial adapter, but keep the adapter in its packaging. And we're going to attach the vial adapter by placing the vial on a flat surface and attaching the vial adapter to the top. So you just press the vial adapter straight down onto the vial using the packaging, and then you'll get a nice satisfying click when it's in place. Now we can remove that packaging, just lift it straight off the vial adapter. We're ready to remove the syringe from its packaging now. So take out the syringe and draw up 1 milliliter of air into the syringe. And we will go over this in person. The syringe has lines on it called gradations and it has numbers. So we'll pull the stopper back to 1 milliliter. And again, we'll go over that. So now we're going to attach the syringe. So hold the vial adapter firmly and the vial, and then screw the syringe firmly onto the vial adapter. And now we're ready to press the plunger all the way down to push all of that air that we drew up, or it's not so much 1 milliliter, but push it into the vial and then turn the syringe and vial upside down and slowly withdraw as much of the medicine as possible into the syringe. It's okay if there's more medicine than the dose. Now unscrew the syringe. So unscrew the syringe from the vial adapter, keeping the syringe upright to avoid any leakage of any medication. Still keeping that upright, now open the needle packaging partway and firmly twist the syringe onto the needle and remove the needle packaging. So now in the box, there are labels and we'll make sure you have pens. And we're going to write the name of the medication on a syringe label and put that label on the syringe on the side without the numbers. It's important to know which medicine goes on which side for later documentation. And now repeat all of those steps 5 through 16 for the other vial of medication. Oh, so now we're ready to administer the injections. So here's the fun part. First, we've got to find and assess the site. So as you see in this picture here, we're going to find the site on the upper outer area of the hip. If you put your hand over your thigh bone and move your hips back and forth, you'll feel a bone sticking out there. That's where you're going to place your palm. And then your thumb will be toward the pelvis with your fingers going to the top of the hip bone. And you separate your second and third finger, little kind of Star Trek motion, I think. And then right between the second and third is where you're going to mark the spot. And we'll give you a surgical pen. You can mark the site. We're going to practice this lots in person as well. So now remove the cap. So fold the needle guard away from the needle and pull off the injection cap. Holding the syringe with the needle pointing up over a sterile pad or sink, press the plunger to the appropriate dose to remove any air bubbles or extra medication. Now we're going to stretch the skin. So we do that by pulling the skin away from the injection site before we put in the needle, about an inch. And you keep holding this position for the injection and the next few steps. So still holding the skin, insert the needle to its full depth into the muscle at a 90-degree angle with a quick, smooth motion. Still holding that skin stretch, slowly press the plunger all the way down. Once the full medicine is injected, remove the needle from the muscle and release the stretched skin immediately. This is called the Z-Trax technique, and it's going to lock the medicine in like a seal. And now we're going to assess the site, so you can grab your gauze that's right there and apply some pressure to the site just to avoid any leakage. All the while being very careful with that needle. So here's a very important part. Do not try to lock the needle with your hands or fingers, but you would fold the needle guard over the needle using a hard surface by gently applying pressure to lock the needle guard in place. That will also make a very nice, satisfying click sound when it locks. And then it goes right in the sharps container. If a Band-Aid's needed, this would be a good time to apply it. So now we're going to repeat steps 1 through 9 for the other medication. So usually the second medication is going to be injected in the other hip, but there are some people who, with their providers, might have it on the same side, but then it would be at least 2 centimeters away from the first injection site. So what are we going to do post-injection? Well, there's a built-in observation period of about 10 minutes. We'll wait at least 10 minutes. Very rare, less than 1% reactions have happened from the rilpivirine medication. Very quickly passing feelings of maybe being woozy, lightheaded, or feverish. These usually disappear within minutes, but because of the chance of this, the 10-minute observation period is important, and we recommend the cab buddy just relax, maybe lie down, and we can chat during this time. If there are any unusual reactions, discuss it with a study clinician to make sure if any other further medical intervention would be necessary. Some tips for pain reduction. Cold and warm compresses both can be nice per your preference. You can use over-the-counter pain relievers like Tylenol, ibuprofen, Aleve, whatever one works for you, if it's safe for you per your provider as well. Walking and movement are great to get the blood flowing, to keep the muscle from freezing up. Exercise is always great. So go for a walk if you can. Self-massage might help, but start that the day after the injection. You don't want to do it on the day of injection because you don't want to move that medication around. So thank you, and that is everything. It's here for you to refer to anytime, and you can also contact us for any more information anytime. It's invite-home@ucsf.edu, or you can call us at 415-294-0609.